and welcome to WRPB and WRPB Studios. It's amazing to me, living in Florida, I'm probably the only person in Florida that doesn't have a bad back. I don't understand it. Everybody I talk to has a bad back, usually from a car accident. And it's what keeps doctors in business. But what most people don't understand is that when you have a car accident, you have a bad back or bad leg or whatever, there is another path to take before you get on all this prescriptions and get on all this medication and go through all this other stuff. With me is Dr. Craig Tankersley,
Correct.
and you are a chiropractor.
Yes, sir.
So here's what amazes me. And this doesn't amaze me, it really kind of bothers me. So doctors don't look at you as doctors,
Correct.
and patients don't look at you as doctors because you guys are chiropractors, and yet you go through more training than so many doctors.
Well, that's actually true, and we take all the classes that regular doctors do, and we'll call them regular doctors. And but then, as we get further along into our study, we branch off more into biomechanics, radiology, and physiology. So where they depart into pharmaceuticals and rounds and different things like that, we continue training all through school. And the training is focused on the spine and how it works and the interaction between the brain and the body.
Okay, why did you pick that path to go?
That's a good question.
So
And
I'm just going to tell you before you go, most people I ask that question to, something in their life dragged them to that point.
Yeah, I would have to say that I didn't choose chiropractic. It chose me because my dad was a chiropractor, and so my background in working was just all over the place. So I grew up in West Palm Beach, worked anywhere from waiting tables in Palm Beach, cutting yards, road work, cleaning pools. I just was kind of like having a good time with my youth. And for some reason, right around when I was about 28 years old, I started saying, like, there's something more. There's something I got to do. With my
I got to
dad,
grow up?
Got to grow up. Yeah, I had to grow up. I just took the long path. So moms, don't worry, your kids are still good. But with my dad being a chiropractor, that was the last thing I wanted to do, because I thought he was crazy. And now I'm crazier than he is, which it was kind of funny. But anyway, I remember the day I walked in to the house. I was sharing a couple of guys sitting on the couch, and one of them, Jimmer, he's like, "Hey, I'm going to go to chef school." I'm like, "You know what? I think I'll go be a chiropractor." And it was almost like divine intervention. And I was like, well, where'd that come from? So from that point forward, I started looking into the school system. What do I need? Started making the calls. And it's amazing how being blessed that I think I am, as well as the talent God gave me, but it's just one thing after another fell in place. And next thing I know, I'm on my way to Kansas City, Missouri with everything I own in the back of a Trans Am, which, by the way, is the worst car to own if you're anywhere there's snow. And off to school I went.
And I get that because I didn't have a Trans Am, okay? I had a Pontiac
Was it Firebird?
Firebird, same car.
Had one of those.
And I lived up north, and it was a snow, covered the roads, and it was the worst car on the roads, like the worst. Plus, but when I got it, when I changed the body style, so everything was made of plastic. It was garbage.
Mm-hmm.
Kind of like our bodies sometimes. Okay, so you get into this field. Was your dad happy?
Oh, God, yeah, he was ecstatic. And of course, he helped me along the way. And then once I graduated from school, and I was never a good student in high school. Graduated John I. Leonard in 79. Did a little bit of college stuff. And then for some reason, once I started getting into chiropractic school, I found out that I really was a lot smarter than I thought. Because you know how we tend to beat ourselves up?
Yep.
One of the big things I tell my staff is that if you talk to your friends the way you talk to yourself, you'd have no friends. So once you can get over that hump, I really started taking off in school and did quite well, and actually graduated with honors in 93.
Okay, so obviously you've been in it a while.
I've been around the block.
So now you come up to the Treasure Coast.
Mm-hmm.
And you said you're an open office up here.
Yeah, it was a circuitous path,
Yeah.
to say the least, because I originally, speaking of dear father, graduated school, came back, thought I would work with him, but I forgot what a pain in the ass he was to work with. Excuse me, guys. So that lasted about a month, and my former wife and I was like, look, I can't work with him. Like, I went back to waiting tables. So I was like, hey, I'm Dr. Tankersley. What can I get you? Because we were trying to figure out what to do. And so my former wife is from Nebraska, and she really was not fond of Florida. So she's like, well, I really like Colorado. So I'm like, oh, that might be kind of fun to try. So out to Colorado we go. We had $800 in our pocket and a U-Haul pulled by a Chevy, I think, Celebrity. Got to Colorado. Within 2 years, we were just killing it, and because I had really good mentors. And so anybody that's thinking of business, you need to find good mentors. I always stress
totally
that to everybody. And so then after being in Colorado for 10 years, I found out that it's a little colder than I anticipated, being born and raised here in Florida. So we wound up moving to Tennessee. I thought I was coming home, but we stopped in Tennessee, and then after 15 years there, I finally was able to sell the practice and the office building, because at different times, depending on the economy, no one could borrow the money. So anyway, that's my story.
Okay, so now you're doing chiropractic. What is the thing that you see the most? Is it bad backs?
It's probably between necks and lower back, and typically with x-rays, the injury 99% of the time is at the base of your neck at what we call C5 or fifth cervical vertebra, or L5, which is your lower back area. The hard part with spine, and that's typically trauma. So sports or whiplash or some type of shearing force will tear the disc, sometimes on a microscopic level, but that sets up out of balance. A good way to say it. So I was just talking to an airplane mechanic, and he's like, why does my back keep going out? And I'm like, well, there's an old injury in there, and it's like having a propeller. If it's idling, does fine. But you get that up to speed. If there's even a slight bit of, let's say, offness, it starts to wobble. That causes stress on the bearings. The bearings start to wear out. And then you start having all these problems. So because of his old injury, his back just is not moving like it should. And when it doesn't move right, it triggers not only muscle spasms, but pain and dysfunction. Now, I should warn you, my answers are 20 minutes long.
That's okay. And it really, you say, oh, I have back pain, but you can have knee pain from your back, correct?
Yeah. And this might not be the best analogy, but what I try and explain to patients is that when your back is malfunctioning, it sends a miscommunication to your brain. Your brain really doesn't care where the information comes from. It just takes it and then figures out best it can what's going on, and then that's what we feel. So my analogy I tell patients is, if you put your hand on a hot stove, the nerve conduction goes to your brain says, get your hand off the hot stove. When you have a cervical problem, it can send a similar signal out of the disc that's similar to the hot stove. So your brain thinks your hand's on a hot stove. But actually the source of the dysfunction is coming from your neck. So that's what we call radicular pain.
You know, it's interesting because my wife has a bad back, bad neck, bad knee, and she gets radiating pain, and she's never sure where the pain really is. She says, well, I got a pain, but I got a spasm in my back, and she's never sure. Now, me, I'm one that doesn't have any of those issues. If a cop pulls up behind me, I get a spasm in my back, my own muscles tighten up.
Yeah.
That's the only time that happens, or if I have a kidney stone. But to me, I say to her, and I could be wrong, what's happening is when muscles tighten up, it causes pain.
Correct.
Okay? I had it with my teeth. If you have an infection and you get swelling, it puts pressure on the nerve.
Correct.
And it causes pain. Do you think that the way things are going, that you're going to start seeing more people with neck issues because we're like this constantly with our phones?
We call it text neck. Okay. So whenever the best way to imagine this is if I had a bowling ball in my hand, and I'm holding it here, not that bad. If I hold it out here, a lot of pressure on my shoulder. And that's what happens whenever our ear or our head comes forward, all the stress is at that C5 level. So once again, C5 just takes a beating. And you'll notice too when people drive, and I do it too, is you'll be driving and you tend to kind of like have your head out. And that's why when you get into like accidents, if your head's forward, then when you get tapped, and all it takes is about 10, 15 miles an hour to shear the disc and tear it. When you get hit, your chest will move forward through space, but your head's going backwards. So that's quick little is what does it. And speaking of teeth, what I typically tell patients when we, well, this is a whole nother story, but anyway, when we take x-rays, they won't tell me everything, because honestly, patients are the worst source of information. And me being a patient, I'm the same way. I'm like, it's not a big deal. Don't worry about it. Just all I need is a stitch. I'm like, no, that's not going to require more than that. But what happens is we'll see degeneration, arthritis, whatever you want to call it, typically in a spot they're not complaining about. And I'm like, well, this section here is going to cause pain at the top of your shoulder. When it gets bad, you might feel in the back of your arm, and you'll have numbness and tingling in these fingers. And they're like, I got that, but I thought that was carpal tunnel. I'm like, well, this is where it's coming from. So pain is really a bad indication of health, because pain's the last thing to show up and the first thing to go away. And another great analogy I like to use is like with dentists. You don't feel a cavity till it hits a nerve.
Right.
So a lot of times when I meet people in public, the first thing they typically tell me is like, well, my back's fine. I know my body. And I'm like, well, that's like me and you saying I know my wife. I know my wife, but she doesn't, I don't always know what she's thinking. So we do know our bodies, but it's not going to tell us when our back hurts, because it has more important things to do. Your brain's busy.
I think what I've learned over the years is you have to, as a patient, you have to advocate for yourself.
Absolutely.
But you have to be honest about what you're advocating.
Mm-hmm.
Okay? Because you can't say, hey, this, because that'll take the direction totally off where it should be.
Well, it's, and I do it too. So I always tell patients, like, look, I do this too. I tend to minimize my problems because I don't want to take the time or the money to fix it. And so a lot of times with patients, they're scared to death. They don't know what we're going to do. They probably watched a couple too many TikTok videos on getting adjusted. And I do a lot of kids adjusting in the office. So we have light adjusting techniques. We have regular adjusting techniques. But anyway, with the patients, I usually tell them all I need to do is see your x-rays, and I can tell you what the problem is. Go ahead.
Telling me what the problem is one thing.
Mm-hmm.
Fixing the problem is another thing.
That's step 2.
Okay? All problems are not fixable, are they?
No, the hard part is once you get arthritis, whether it's your knee or your neck, it's forever. It's never going to go away. So we can't get rid of it. So that's going to cause a structural weakness that if you, like let's say you have a car with a loose front end, every time you hit a pothole, you got to go get it realigned. Life has many potholes. Gravity even can cause stress. So that's why when we get into maintenance care, it's just like brushing your teeth or going to the gym. Once we fix the problem, we want to maintain it. Or you can wait, 6 months, let it flare up and come back, and we'll just start all over again.
So, for some people, treatment is ongoing and in perpetuity.
Yes, if they so desire. And so that's one thing once we finish the initial care plan. And most care plans are 12 to 24 visits. Just depends on the person, age, weight, occupation, x-rays. And I'll tell them when we're done, I'm like, okay, what I'd recommend you do, I just had one this morning. I'm like, I recommend you try and get in every 2 weeks to keep what you got. Over time, we'll figure out what schedule works best for you.
Interesting. All right, getting to the top of our time, and there's so much that can go on in talking about this. I wanted to talk about decompression therapy. There's a bunch of things that I've seen in my life that I have no answers for, and I'm sure you guys have no answers, but there's only a certain amount of time, and we're at the top of that. So how do people find you? Where's your office?
We are located in Stewart, so we're 2327 Northwest Federal Highway. We're a quarter mile north of LA Fitness on the same side of the road, next to Legacy Marina. I get to look at their boats all day. And I'm sure you'll have our phone number and information on the screen.
Yep. The thing that I know, and I know it because my wife has all these issues, is that the last thing you should ever do is surgery.
Mm-hmm.
And right before that, you should not do drugs.
Yeah.
Okay? Because that sometimes is worse, because if you have an issue and you take a pain pill, you're just going to aggravate the issue because you're not feeling it.
You're just covering up the problem.
Right. So it would behoove you to go see the person who knows the structure of your body, let them do the x-rays, and make the determination from there. Always try to take the path that's going to keep you the safest and the simplest, in my
Well,
opinion.
exactly. Least resistance, I guess, is an easier way to say it. So there's always drugs and surgery are always an option. Sometimes that's our only option.
Right.
It's just the way it goes. But even after patients have had surgery, I continue to work on them. So there's 24 bones in your spine. We're going to fuse 2. Let's say you're C5, C6. You got to fuse it because it's just boogered up. There's still the ones above and below it that if we don't maintain those, they're going to go out next. So as an example, my stepmom has had 5 surgery. Her neck is one big fusion now. And, bless her heart, she just picked the path that was best for her. But now she's 72 and just is not a high quality of life.
Oh, that's terrible.
Yeah.
Everybody, check Doc out. Okay, Tankersley Chiropractic. Is that what it's called?
Tankersley Chiropractic.
And it doesn't hurt to go and have him just check you out, and then listen to what he has to say, and then make your decision. Okay?
Absolutely, yes.
Do your research after you know what a professional has to say, not your research first. That's backwards. Okay, Doc, I want to thank you for coming on.
Thank you so much. And before we close, I should mention that we are having a $21 new patient special, which includes your x-ray and adjustment. And that's a way for me to show you what's going on, then you decide what's best for you.
Everybody have a great day. We'll be right back.
Thank you.